Hello, everybody. My name is Justin Bruns. The QI project that I completed this semester for professional nursing included focusing on nurse burnout, specifically in regards to New Ulm Medical Center. It's a part of Allina Health down in New Ulm, Minnesota. All of this information was gathered, as well as supplemental information that was gathered after during the leadership clinical that took place in early October. This was one of the concerns that was raised by the director of patient care that I worked with, being that the retention rates and the burnout rates of current staff that they're kind of seeing, and really that there's no efforts that are being made to try to reduce the retention rates. So this is what my project kind of focused on, specifically looking at the viewpoint of the nurse managers and kind of providing that information to them. So a little bit of the background evidence. I wanted to provide the statistics. They're pretty resounding. I was able to find statistics in regards to current burnout rates, either nationally or in comparison to kind of up-to-date information that we've been seeing. So from Western Governors University, they were able to report and do some research regarding current RNs. So they found that, at least in the hospital setting, 43% of RNs are experiencing burnout symptoms. 33% of RNs in nursing home facilities are also experiencing burnout, and that 50% have actually considered leaving the profession in general. So that kind of raises the point and the importance as to why this phenomenon keeps plaguing our healthcare facilities, and the reason behind, why future strategies should focus on retaining staff, along with the recruitment strategies as well. I was able to find a little bit of what burnout symptoms are kind of common or particular to nursing staff. So a lot of them report actually from an evidence-based article that I had found by Capel. This was actually kind of specific to like the COVID-19 pandemic and to what they've been seeing, but these symptoms have also been brought up even before the pandemic had started. So common symptoms that they see are fatigue, dreading going to work, feeling underappreciated, and feeling constantly overworked. Some of the background history that I found. So, like I said, this project was specific to New Ulm Medical Center. It's a regional facility. It's affiliated with Allina Health. So bigger hospitals of Allina Health include like Abbott Northwestern, United Hospital, Unity campuses between Mercy. And a lot of these institutions, so the mission itself for New Ulm Medical Center is very similar to the other bigger hospitals that are in the metro area, but the basis is very much patient care oriented. So the mission is that they want to serve communities by providing exceptional care, as they prevent illness, restore health, and give comfort to all those who trust them with their care. Along with that, they take pretty highly into account their values that they would like to uphold, and that would be integrity, respect, trust, compassion, and stewardship. And a lot of times, especially with the interview that I conducted with the director of patient care, she came back to these values, and these values are very important in the aspect of that it should also be involved in staff as well. So, respecting and trusting staff and giving compassion when needed, but also having the integrity to follow up with these future strategies, which was why the concerns were wanting to be addressed with how to retain these staff in order to try to uphold their mission and values. So a little bit more of the history. So this QI project, there hasn't been much research or data that support retention efforts to reduce nurse burnout. There's one that specifically addresses the retention in general. So I guess, but it solely focuses on like new grads coming in or new graduate RNs that are coming into the profession. So back in 2017, there was an article that found that Allina Health and also Newell Medical Center, and that was confirmed by the director that I worked with, they implement a nurse residency program. And what that is that it basically allows time and gives the proper training to new grad staff so they're not overwhelmed as they come into the RN profession. So that's just one strategy that they've been implementing, but I honestly could not find current efforts that were being made for the current staff that are there. So the aim and purpose of this QI project in general was to increase understanding of nurse managers, specifically about nurse burnout, to kind of aid in recognizing early burnout symptoms in current staff and to propose future strategies to reduce retention rates. And that was kind of the biggest thing. And I think stressing the importance, and the director had brought this up too, and how to recognize those early burnout symptoms. Like I covered before, the fatigue, feeling underappreciated, not wanting to come to work, just what evidence-based research is kind of out there right now in order to try to recognize those, to increase knowledge and understanding of burnout itself, but also what strategies are being implemented in order to reduce these retention rates that are in healthcare facilities now. So there was a couple of outcome measures that I had from the quality improvement project that I conducted. One of them was to create a PowerPoint presentation. This was the artifact that I created for the course. And this was specifically going to be shared with the director of patient care. And then she was going to relay that in a management meeting or something that they would look at personally, emailed to them. A lot of the communication does occur via email. So another one was to conduct subjective interviews. And this is what I actually liked the most about this project. I was able to conduct subjective interviews with both nurse managers and staff nurses to kind of gain correlations between perceptions of nurse burnout, but also contributing factors that might be attributing based off of the facility. The interviews that I conducted were specific to the ICU setting, but also the medical surgical setting for both nurse managers and staff nurses. There was also one process outcome, and that was creating a presentation via PowerPoint. And I also created a share or an audio file similar to what I'm doing right now, kind of discussing the presentation and the contents involved. So the results, I made a couple of tables in regards to the interviews that I conducted. So the first one here, table 1, we'll look at the interview with the nurse managers. So this table really demonstrates the formal interview that I conducted with the 2 nurse managers. The nurse managers were basically told that to answer the questions to the best of their ability, but also that they would be recorded anonymously. So that was one big thing that I wanted to convey to them, was that there wasn't going to be anything that was going to, this was just on the basis of gathering statistics. So the questions that I asked were along the lines of staffing, communication, and collaboration. So the first one that I asked was kind of specific to staffing regarding, nurse to patient ratios and how does acuity play a role when deciding staffing. So the manager 1 from the ICU said that typically the nurse to patient ratios are 2-to-1 depending on the acuity of the patient status and the staffing consensus. While as manager 2 from the medical surgical floor, the nurses are usually staffed to 4 patients during a shift, which is pretty common depending on the facility and kind of the consensus numbers of the patient volume that are being exhibited. But at times, that manager noted that they sometimes do have to increase that due to staffing shortages. And that was one of the biggest things that was driving kind of the correlation between the reason behind why the nurse retention rates are so high at this facility in general. The second one was along the lines of communication. So how does important information get communicated to staff? So the ICU manager specified that it was detailed via email. Sometimes this manager does present information to staff in person, depending on what the matter of the cause was. For medical surgical, This was a little bit different. So usually that information is given to charge nurses, and that's later passed down to other nursing staff. So that might be a communication um, error on that part, but obviously I'm not going to be assuming anything. But that's just what I kind of saw between the two. The last one, like I said, was based off collaboration. So what do the relationships look like the interprofessional team relationships look like with like nursing staff, and what kind of ancillary support is available when staffing shortages occur? And what I mean by ancillary support is there callback time? Is there like a restriction to being called in, or is there like a somebody who fills in from a different floor, like kind of like a unit relief? So the ICU manager was able to specify that the interprofessional relationship staff is positive, being that, and it kind of specified that respiratory therapy is needed quite a bit in the ICU department, which is pretty common, being that most of them are either ventilated or on some sort of supplemental oxygen. So that was good to see. But usually, staff nurses are designated a buddy system to help in departments that are short staffed. And what they meant and specified in the buddy system was that one person would offer like unit relief if there is staffing shortage. Like, say for instance, they would pull somebody from like the mental health unit to come down that would be cross trained in order to try to fill in, to try to provide some sort of stress relief to the current staff that are there. Um, the second manager from the medical surgical floor um, believes that the relationships with the interprofessional team members could be improved. Um, they also touched on the buddy system, that it has been helpful, but feels like they're kind of the last department to receive help compared to other units, which could be a proposed future strategy, to try to focus on kind of the diversity of implementing that buddy system to try to help out this unit. But that was actually one point that was proposed in the artifact that was provided to nurse management. Secondly, the table 2, this is kind of the interview with the staff nurses. So this table kind of details an interview conducted with 2 staff nurses, very similar to the first table, an interview that I conducted, one from the ICU setting, one from the medical surgical floor at the hospital. They were told, the staff nurses were kind of told to answer in a yes/no format, just to kind of see if there's any correlation between symptoms and burnout at the facility. This was also completely anonymous, and they were reassured that just so that ethical concerns were kind of diminished. So the first question asked, and these interview questions focused on the symptoms that I had found in the CAPLE study that I had seen. So, do you feel fatigued or overworked in your current unit? And both of the staff nurses, both in the ICU and the medical surgical unit, actually answered with yes. Do you feel appreciated in your current nursing career? This was very interesting to me, and honestly was kind of disheartening to see. Do you feel appreciated in your current nursing career? And both of them answered no. So it's kind of seeing correlation between, are they receiving the support that they need, this ancillary support that they need, or going back to, are they feeling fatigued or overworked? Is there anything that can be proposed future strategy wise and next steps, maybe with this QI project or with nurse managers, that they might not be overworked, and staffing shortages is common wherever you go. It's something that's been common over the past couple of years, and it's just something that needs to be fixed in the future. But one thing that I did find, do you enjoy coming to work daily? The staff nurse in the ICU answered with yes, but the staff nurse in the medical surgical unit answered with no. So that might be, maybe something that I had found in the interview with the management, that maybe they're the last unit to receive help or ancillary support when it comes to staffing, but it's just the kind of the results that I had gotten from the interview. So the discussion wise, what went well? Personally, I believe that, gathering information for the presentation went very well. I was able to collaborate with the nurse leader to kind of find the current efforts. I was able to kind of find and utilize the Allina Health System, AKN is what they call it, um, to find the detailed information to kind of put into the artifact as to what the current efforts currently are, but also the time given to conduct these interviews. It was awesome to get that perspective. I believe that this made the QI project more personal, specific to the facility, and with the SMART goals that I had to start the QI project, I believe that I attained them based that they were specific and timely. Kind of what was unexpected. So I was surprised that I was able to get participants from the same care area, so I was able to kind of see correlations between the two, and just so that it wouldn't cause um, any sort of falsified information from getting one person from a staff unit that's always completely different based off of the managerial people that I had interviewed. But also the current statistics about nurse burnout. I knew that this was a common problem nationally and statewide, but I was very surprised and honestly was unexpected to see the findings that I had seen. And it just kind of stressed the importance on focusing on these future efforts. So, what could be improved? I guess gathering more diverse statistics from a greater variety of staff, maybe focusing on either clinic settings or anything like that compared to hospital settings, just to kind of see the comparison between the two and just get more diverse statistics from that end. But also, I believe providing the presentation earlier, maybe presenting in person, that might have helped, answer any questions that the managers had or address any of the concerns that might be urgent or that they wanted to express. The next steps that could be conducted, kind of following up with the director of patient care, just to kind of see if that presentation was shared with management. Maybe reflecting on new strategies that were proposed. Maybe the managers saw this presentation and generally accepted the strategies that were proposed, but also, maybe have some other ideas that might be helpful as well. And just kind of answering those questions and addressing the concerns, like I had stated, and maybe providing the presentation in person might have diminished those questions or concerns, but that would be one thing that I would like to do in the next steps. So the conclusion, like I had stated, the aim and the purpose of this QI project was to just kind of increase that understanding and knowledge of the nurse managers of what is nurse burnout, how to kind of aid in monitoring these burnout symptoms in current staff and maybe new staff, but also proposing future strategies that might help reduce the retention rates specific to the facility. In general, one outcome measure was partially met. That was the, creating the presentation and sharing it with the director of patient care. But I guess it was partially met because I wasn't able to, follow up to see if they were able to receive the presentation and just kind of see what their viewpoint was on it. But one outcome measure was met. That was the one where conducting the subjective interviews. I was able to meet that and kind of gather that information and see any correlations between the two departments. One process measure was also met. Like I had stated, I was able to create the presentation and actually share an audio file with the nurse or the nurse or director of patient care in order to get that relayed, so I can explain the contents that I created for that presentation. And just kind of focusing on the next steps. As I concluded, there could be multiple next steps, and nurse burnout is something that has been a phenomena for like the past few years, and obviously the pandemic is not aiding in reducing those numbers. But kind of moving forward and seeing the importance of withholding staff, and withholding these numbers and contributing to the support that they need could be the answer. But this QI project in general was just kind of address those concerns. Thanks for listening to this presentation. If you have any questions or comments or concerns, just get in touch with me. Thank you.